Our next guest is the author of the Meschino Optimal Living Program, Dr. James. Is it Meschino or Meschino?
Meschino.
Meschino. Welcome to the program.
Thank you.
Yeah. Now we've got some. We're talking all here about how to be, feel and look our best, right?
Yeah.
We are, and also how to slow down the aging process. We're understanding from anti-aging research that there's a lot that you can do with diet, exercise, and using the right dietary supplements to actually intervene with the body's own genetic timing for certain aspects of aging, which are also linked to degenerative diseases.
Of course.
So we're seeing that more and more the way people live their lives, the lifestyle choices they make, has a huge impact not only on the risk of cancer, heart disease, dementia, osteoporosis, and so on, and the lack of fitness, weight gain, but also on how much you can actually slow down the rate at which your body will age, and certain things that you can do to reverse the aging process itself.
It's all the rage. Everybody wants to look at, and my parents, for goodness sakes, were in their 80s, and my dad would always say, not bad for a young guy. It was always like a state of mind. He always felt young and looked young and always carried on that way, and I thought, boy, it's got to be all in the head, how old you are, really.
Well, I guess he made some decisions to always keep doing the things that he did when he was younger, rather than surrender to, I'm feeling tired, I'm feeling weak, I'm not the person I used to be. He kept fighting it tooth and nail, which is part of the which is, to his credit.
Right.
But we now know scientifically, as best we can determine it, what are the specific nutritional strategies you should use, what kinds of exercises are going to give you the best results in terms of maintaining your lean mass, keeping your body fat down, having the aerobic fitness you want, the flexibility, and then what diet. People are 60% of Canadians are buying dietary supplements, but oftentimes they're buying things that are really inappropriate for them. No one's really guiding them. So in chapter 5 of the book that I wrote, it explains to people based upon who you are, male or female, your age, certain health factors that you may be concerned about. What is the supplementation strategy that's going to give you the best results?
Exactly.
So go ahead.
Oh, well, I was just wondering, like, a lot of people, they think that, if your skin looks good, which it's true, that you're going to look younger, so they put creams on their face. But there's so many other things other than just putting creams on their face that they can do, like nutrition-wise, to look younger. So what kind of foods should people be eating to be looking younger?
Well, it starts with a low-fat, low-glycemic diet. And people say, I'm tired of hearing this, but the reality is you have to really reduce your intake of high-fat animal foods. I mean, if you saw the movie Super Size Me, the evidence, that's an extreme example.
Sure.
Right.
But many people walk around with certain variations of that, eating high-fat animal products on a regular basis, gaining weight, cholesterol goes up, and it affects the skin because the skin takes some of those fats, makes them into hormones that make the skin dry, rough, scaly, accelerates the aging process. So eating a low-fat, lower glycemic carbohydrate diet is the first step in terms of nutritional intervention.
Okay, and you know what? Everybody who comes on always says water, 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 water.
Is it
well,
necessary?
certainly you need fluids. Your body, and most of the chemical reactions in your body take place in a water medium, so to me that's a given. I talk about it early in the book to get it out of the way, but you can overemphasize certain things. The big problem in our society is a high intake of saturated fat, a high intake of overly sweetened foods, and the resulting weight gain, high cholesterol, and other aspects of degeneration that come with that.
Type 2 diabetes almost. But listen, you've got some wonderful products here. What exactly are we looking at?
Well, I thought I would bring along some of the supplement combinations that I think are the most critical for people to know about.
Good to know.
A lot of people walk around and they'll buy, vitamin C and vitamin E and beta carotene and a multiple vitamin. What I'm saying is that you should be able to, if I pick up a multiple vitamin like this one, like the one I'm holding, that you should be able to get all of the antioxidants that you need, all the B complex that you need, most of the calcium that you need, all from one product. So you don't have to buy 7 different things to get calcium, B complex, C, and that's what the companies want you to do. But there are professional products now that have all of that into one. And the reason that's important is because after the age of 40, certain genetic changes occur that set the stage for more advanced degeneration. You have to then add other supplements. I'll give you an example of one. This is Cardio Essentials. In it is coenzyme Q10 and an herb called hawthorn. After the age of 40, your body starts making less coenzyme Q10. The result is that you can't convert food into energy as well, and so the body, you start to get tired and you slow down. The heart pump becomes weaker, which can set the stage for congestive heart failure. The brain can't process information as well, setting the stage for cognitive decline. Can't think as clearly, and it can lead to other problems. So after the age of 40, because your body doesn't make that nutrient at optimal levels, we see that people who put that back in at the optimal dosage start to forestall the aging process and can maintain more optimal function on all levels. For men, the prostate gland often starts to enlarge after age 35 or 40. We thought it was just the aging process, there's nothing you can do. But now we know why the prostate enlarges. It enlarges because the prostate starts to build up a very undesirable hormone called DHT, which causes the cells to divide faster and the mass increases. But you can block that process in a natural way with specific herbals like saw palmetto and pygeum. I don't want to get into the technical names, but we have clinical evidence you can even shrink enlarged prostates down using natural interventions. And so there are a number of products that I talk about in the book to keep the immune system stronger. As women go into menopause, if they don't want to use hormone replacement therapy because we know the dangers of it, there are alternatives that have been around for hundreds of thousands of years, really, that can manage menopausal symptoms, slow down the aging process in women. And so it needs to be a coordinated, staged-in effort to get all these things into your body at optimal doses if you want the optimal type of result.
So for men and women, I mean, there's different kinds of supplements that we should be taking because our bodies are different, obviously.
Exactly right. Women need more calcium, sometimes more vitamin D to reduce risk of osteoporosis because that drop in estrogen is so severe. So in the book, the Meschino Optimal Living Program, when you get to step 5, it's a 7-step program. And step 5 is, okay, here's where we start to separate, you know, how you really personalize this for yourself in terms of the supplements you're going to take. Don't be spending your money. It makes me so sad to see people walk into a health food store, spend money on things that are not really the most appropriate thing for them. They're going to spend money on this. Get the right products to get the end result that's going to be most meaningful for you.
I'm glad you put this book together because I'm telling you, for goodness sakes, I go in with my wife because she wants to buy certain things for herself. And the variety is endless. And
it's a sea of confusion.
It's certain, and of course, I should take some of these. So how many do I take?
And
I don't know, 1 a day, 10 a day?
And not only that, but if you look at certain products.
Do not use with that.
Yes, certain drug nutrient combinations can be dangerous. But also, let's say for women, we know that black cohosh can be very effective at managing menopausal symptoms. But if it's not standardized to yield enough of the active ingredient, which is this triterpene glycoside compound.
I knew you were going to say that.
I knew you knew.
We're on the same page.
But unless it's a standardized grade of black cohosh at the right dosage, 40 or 80 milligrams twice a day, it's useless. And unfortunately, in the supplement industry, and I'm part of it, so it makes me sad to say this, but the reality is many companies just throw anything out there, these whole herbs that are not standardized grades, that don't really do anything. People try them and say, didn't really help me.
But because they got the name on them, right?
It has the name, but it doesn't have the right dosage and the right... So the books helps to make people more informed consumers so they can choose what's appropriate.
Thank you so
much.
much.
Thank you very much.
Thank you so much. And for more information, you can go online at nutratherapeutics.com or you can call 1-888-251-1010.
The book's available in bookstores right now. Stay with us. We'll be right back in more Daytime.
You bet.